plantar fasciitis. Now, a lot of you guys will get this in your lifetime, and it will be chronic. It will be very, very limiting. And most people get it. Why? Because they don't look after their fascia. It's in the word, plantar fasciitis. Yet, most of the time, it is treated like it's a muscle issue. And then when I treat people, I explain it, I give them the exercise. Wow, it's gone away just like that. I tried everything. Yes, but it comes back if you don't look after your fascia, because as we age, fascia dries out. Okay, so you always should be on top of plantar fasciitis or any type of itis within the body, which is inflammation. Now, when we work on our fascia, it remodels, okay? So if we're in poor postures all day, it will remodel to that posture. If you're standing in the wrong loaded position for your foot, it will remodel those structures in that way. So hence, we need to be very aware of how we're standing, from our toes, our foot position, our knee, our hips, and our jaw. If you have tightness in the jaw, weak feet, I guarantee you have a weak core. So learning how to actually look after the fascial line, which is the superficial back line, if you have plantar fasciitis, that's where I would start and continue to work on those exercises for life, because it's going to make you feel great anyway, and you're going to keep moving with ease. You need good hydration, and you need hydration to get to that fascia. You need to limit the amount of inflammation within your body, and we can do that through the nervous system, through hydration, and through our nutrition as well. So all of this works in sync together. So let's go through a few exercises instead of me harping on about how you need to look after your plantar fasciitis. Let me show you exactly how to do that. And there is more to it, but I will show you some great exercises that you can benefit from now and for good. So firstly, okay, your fascia, you're standing on that foot. Have a look at how you're standing. We need to create a tripod position so you're distributing the weight evenly through the tissues. The tripod position is the center of your heel, the base of your pinky toe, so not your pinky toe, but the base of that toe, so at the ball of your foot, and the base of the big toe. You want to flare your toes from there and try and reach them out and down, okay? So from there, you want both feet in that tripod position, and you want to think of how you're loading your foot. So shift your body weight forward, shift it back. Feel when the foot lights up. Okay, my center of mass is now over my foot, and my foot muscles and my fascia is tensioning and working. That tension then we want to lead all the way up into our pelvic floor. So those fibers from the big toe, as we walk, it tells our body where we are in space and how to stabilize further up the chain. So now I know where my center of mass is over my tripod. I want to link in my adductors and my pelvic floor, the deepest core muscle that stabilizes our whole unit and spine. When that switches on, the transversus, another core muscle, switches on. And then we link it to our diaphragm, a deep core muscle. Now, why is all of this important, right? I'm talking about the foot, center of mass, pelvic floor, diaphragm, our jaw, our posture. Basically, if we can't lift ourselves up against gravity, right? We're being pushed down, pushing down into that fascia all the time. If we can't lift ourselves up from our foot and load our body, engage the muscles of our foot and feel that lifting up, we're not going to feel light in the foot. We're going to feel that pressure in the fascia the whole time. It's not going to bounce back against that force of gravity. So we really need to know where our center of mass is, lifting up through that pelvic floor, breathing properly, and centering our head over that center of mass. As you walk, the head will then follow that center of mass. Everything is loaded equally, balanced. If you've got plantar fasciitis in one foot, that's going to tell you that you're unbalanced in one side. So you need to work on this first. Then we have our trigger point balls, or doesn't matter if you use a golf ball, doesn't matter if you use a tennis ball. You want to roll over that fascia. Start to get some blood flow, hydration, moving through the tissues. Okay, so when the tissues are stuck, like honey, right, it either hardens up and it doesn't move, or we warm it up and it starts to flow and move easily. That's what we want. We want those tissues moving with ease and not being stuck. So this is where it comes in. Then you want to use a pinning down and stretching over that pinned muscle. So bring your body weight over a certain point and then up and down with the toes. So we're kind of flossing and shearing over that fascia, and that will create or help us generate more of the hyaluronic acid, which binds water, which again helps us with that hydration in the tissue. Okay, and then we sit our heel down and sweep over the ball of the foot. So we're opening up that forefoot so we can get better toe splay. We don't just want to focus on the bottom of the foot, we want to focus on the top because we want to work on evenness. So you're going to point your toes away from you, open up the knee, so extend at the knee, also extend at the hip, it's all connected, and reach and work on that fascial line by grabbing the wrist and pulling up to the ceiling, all the way from your toe through to your hip and your wrist. Breathing about 5 deep breaths. Now our breath is important. We need to make sure it's a really big in-breath, another in-breath at the top, and an out-breath, soften, because it helps our brain feel safe. We also need to modify what's happening in the nervous system. Okay, so when we're in pain, it alerts the nervous system, and that can be a chronic cycle. So your breath is the only way as well to help your nervous system to reprogram that pain response. Okay, so that's all connected as well. Last of all, you're going to work on your calves because it connects all the way up through the back line. So this backline fascia, plantar fascia, calves, goes up to your hamstrings and then into your eyebrows. Imagine if you've got a stocking and I pull on the stocking here at my eyebrows, it's going to create tension down at my feet. So we unlocked the bottom of the feet, starts to unlock the tension in that superficial back line, but the calves really hold on to a lot of tension here. So we want to cross our legs one over the other at the Achilles, at the bottom of the calf, and we drive pressure downwards as we go from right to left side. We also flex and extend, and again, producing that hyaluronic acid or synthesizing it, and then that can help with hydration. Now with remodeling fascia, it takes around 3 months, so be patient. If you want to get out of pain straight away and you don't even realize how you got into it, it takes time. You are used to certain movement patterns that have caused that pain. You have to reprogram and start using new movement patterns. That's why we work on your posture next and work on the way that you actually walk. We've just worked on the way you stand, and you need to program that into your daily life. Again, with this, make sure you're breathing in and out. Soften the nervous system response. Work on it and hydrate after the session. I like to integrate it last of all with just a downward dog as it brings tension to that whole line. I'm going to shift my head in so my eyebrows are also being tensioned. Okay, from my eyebrows through to my hips, go into more of an anterior tilt, bringing the hip bones up to the ceiling. And then as I elephant walk, I'm trying to walk up to my hands, but I'm bringing my toes up as well at the same time, creating a really deep stretch on that back line. Might hold, breathe in, breathe out. Breathe in, breathe out. Practice it and continue. Maybe once a week, maybe once a month, but if you've got plantar fasciitis right now, maybe you need to do that daily. If you've got any questions, please DM me. I do have programs with all the information and the add-ons and the programming that you would need into the future to really understand this fascial system and improve your movement patterns for life using the Blacklock method. Thanks for watching. Like, comment, subscribe, and share.